Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every symptom is a real story. And today's topic focuses on something many families in older adults tend to underestimate: that persistent cough, that quiet breathlessness, that unusual fatigue, that reduced appetite, that mild flu that doesn't fully go away. At first, it looks harmless. Maybe it's just weather changes. Maybe it's dust. Maybe it will pass. Maybe they just need rest. But in older adults, what looks mild on the surface can shift quickly underneath because the lungs in aging bodies do not have the same reserve. And when breathing starts to struggle, the entire system begins to feel it. When the pattern starts quietly, in clinical practice, pneumonia in older adults rarely announces itself loudly at the beginning. It often starts small: a mild cough, slight chest discomfort, noisy breathing at night, unusual tiredness, reduced appetite, slower movement, occasional confusion or sleepiness, sometimes even without a high fever. And because it looks mild, life continues. Eating a little, walking a little, talking normally, resting at home. But underneath, the lungs may already be inflamed. Oxygen exchange begins to weaken, and the body quietly shifts into stress mode. Then the pattern changes. The cough becomes persistent, breathing becomes heavier, walking becomes tiring, lying flat becomes uncomfortable, appetite drops further, weakness increases, and suddenly everyday activity starts feeling like effort. At that point, it is no longer just a cough. It is a respiratory system losing efficiency. Doctor's perspective: what is really happening? The lungs are not just for breathing. They are the body's oxygen gateway. They supply oxygen to the brain, the heart, the muscles, the kidneys. Every system depends on them. When infection enters the lungs, inflammation builds. Fluid and mucus reduce air exchange, oxygen delivery drops, and the body begins compensating. The heart works harder, breathing becomes faster, fatigue increases, confusion may appear, and weakness becomes more obvious. In older adults, this happens faster because reserve capacity is already reduced, especially when conditions like diabetes, heart disease, obesity, kidney disease, or chronic inflammation are present. So the pattern is not random, it is progressive. Infection leads to inflammation. Inflammation reduces oxygen delivery. Reduced oxygen increases body strain. Body strain reduces mobility. Reduced mobility slows recovery. And once this cycle starts, ignoring it allows it to deepen. Nurse's perspective: the small signs that matter most. From the nursing perspective, the earliest danger is often subtle change, not dramatic collapse, but gradual decline. Breathing becomes slightly faster, speech becomes shorter, appetite drops, sleep increases during the day, confusion appears in familiar surroundings, cough becomes more frequent, movement becomes slower, and the patient tires easily even with small activity. These are not small signs. They are early warning signals of oxygen stress. Supportive care at this stage is critical: keeping the patient upright to ease breathing, encouraging small, frequent fluids, monitoring temperature and breathing, supporting gentle movement when possible, ensuring nutrition is not neglected, and watching closely for worsening distress, because deterioration in older adults can happen quietly before becoming severe. Pharmacist's perspective: treatment must be carefully balanced. When pneumonia is suspected or confirmed, medications may become necessary, especially antibiotics in bacterial infection. But in older adults, precision matters. Dose, timing, duration, all are critical. Stopping antibiotics early can allow infection to persist, but unnecessary or excessive medication can also cause harm. Some cough medicines may suppress useful airway clearance. Some sedating drugs may worsen confusion or falls. Drug interactions become more likely with multiple chronic medications, and kidney or liver function may change how drugs behave in the body. So treatment is not just about giving medication. It is about safe, structured recovery without creating new complications. Dietitian's perspective: Recovery needs fuel. Pneumonia recovery is not only medical, it is metabolic. But many older adults lose appetite during illness. They eat less, drink less, lose strength, and muscle wasting can begin quickly. This slows recovery further. Supportive nutrition becomes part of treatment. Adequate hydration, protein for tissue repair, soft, easy to eat meals, energy rich, nutritious foods, fruits and vegetables for immune support, small, frequent meals instead of large portions, monitoring strength and weight during recovery. Because the lungs do not heal in isolation, the whole body supports recovery. Now step back and see the full system. It often begins with a mild cough, then inflammation develops in the lungs. Oxygen exchange becomes less efficient, fatigue increases, movement slows, appetite drops, weakness builds, the heart compensates, the body becomes stressed, and recovery slows further. What looked like a simple cough becomes a whole body condition. That is why respiratory illness in older adults must never be underestimated. Not because every cough is dangerous, but because the pattern can change quickly underneath. Final point. Not every cough in an older adult is harmless. Not every fatigue is just aging. Not every breath sound is normal. And not every mild symptom stays mild. Sometimes the early signs are subtle before sudden worsening. That is why early attention matters. Careful observation matters. Hydration matters. Nutrition matters. Medication safety matters. And timely evaluation matters most of all. Because early treatment can prevent severe pneumonia, hospital admission, breathing failure, loss of independence, and life-threatening complications. So do not ignore a persistent cough in older adults. Do not dismiss increasing fatigue or breath changes. Do not wait for severe distress before acting. Observe the pattern, support the lungs early, protect the whole system during recovery, because in respiratory health, timing changes everything. For consultations, education, or medical guidance, PHI Preventive Health Institute, call/WhatsApp +233 2800 and 720347.